Welcome back to FP Executive. I'm here with Giovanni Vatieri. Thank you again for joining us today. And we were talking about the Victorian Order of Nurses and how they are moving to PDAs, optimized routes. My question to you is, and I think it's the question that many Canadians have, is are these changes improving care, particularly in this instance of the Victorian Order of Nurses? Are nurses spending more time with patients because of this system?
Well, let me just describe. Let me fast forward for a second, because one of the interesting things that we're doing with the VON is we're doing some basic things to help them today, but we're also working with them in collaboration to do some innovation for the future. Let me just take you. Let me fast forward 5 years out on an innovation that we're doing with them today. That is reality. It can easily become reality. So one of the things we're doing with them is a very specific element of what we're calling a smarter support system. And we're working with them on an innovation where we're testing chronic health failure patients who are at a certain grade and a more severe level. And what we want to do is go in and put a series of sensors in place, as an example, and then the VON has this 12-step process where they engage them through 12 visits to document certain things and test certain things. And then the data from both the sensors that are measuring things pervasively every day without people even knowing that.
And these are sensors on the patients?
So they could be. They could be as simple as things that monitor their blood pressure or whatever. But the data automatically goes somewhere. The data that they collect, that the Victorian Order of Nurses collect through this 12-step process, also gets sent. And then all these data are run through analytics that we have worked with them to develop that say, if this and this and this, then the following. And it would provide a series of recommendations. So we're doing this, and the intent here is CHF patients grade 2 tend to have a higher hospital readmission rate. We're trying to reduce hospital readmission. By being able to provide them better care in their home.
I see. So the analytics determines, in essence, the probability of a patient's chance to go back to hospital, and the VONs are trying to intervene before that occurs?
It'll actually make recommendations as to what you can do to prevent the readmission. So we're now doing this innovation in a very specific area, right? So fast forward 5 years from now, when this innovation becomes much broader than just chronic health failure patients, where it's for diabetics or anybody who's at home, we go in with a suitcase, open up the suitcase, put 5 sensors in place. Analytics are already there. The nurses are doing whatever process they do, and in real time we're getting advice. All of a sudden the patient can become more independent because things are happening around them that are monitoring them in real time. And that might notify Mrs. Jane's daughter that Mrs. Jane isn't moving right now, or it might notify their doctor or even an ambulance for that matter. So the things that we're putting in place with them today are basically leading to this concept where the technology and the processes of care that the nurses are delivering enable the nurse to be able to provide better, more timely, more accurate care, because either they're being prompted with certain things or being provided data that they wouldn't have otherwise had, and they don't have to waste their time entering it or writing it on a piece of paper.
Well, this is, in some ways, this is revolutionary the more I think about it, because through the analytics, you're essentially delivering a spectrum of probabilities of readmission or other problems for each patient, and therefore you can tailor the patient's care according to that, which is really amazing. The efficiencies that come out of this, it sounds like people would be less likely to be admitted to hospital, or care would be delivered prior to the problems arising. This has got to save people money, I would think.
Well, we can look at it in a bunch of different ways. Purely from an operational point of view, the nurses will not be wasting time doing non-nursing things.
So they're not filling out
there's
paperwork.
Right. Then there's the part about since these things are happening, you can enable people to stay at home much more than not.
Right.
So all of a sudden the healthcare system is being saved in that someone who would normally have had to stay in the hospital an extra couple of days can go home, or anyone who really didn't need to be in hospital but you didn't really want to have them at home alone, now they can be alone. So there's that other set of savings.
Right.
And then because you now have the analytics providing advice and triggering certain actions when a certain set of conditions are met, you prevent incidences like going back and having the ambulance pick you up and readmit you, and possibly having some horribly acute incidents occur that could lead to increased morbidity or mortality.
Interesting. This has really been fascinating, and you're doing great work. Thank you so much for joining us today.
Thank you.